Hey everyone, my name's Chelsea. I'm a physical therapist with Renew PT, and today's video is part 2 of a 5-part series about the top reasons why you should see a pelvic floor PT. So today we're going to talk about something called urge incontinence, and urge incontinence is the loss of urine whenever you get a strong, sudden urge to go to the bathroom. So oftentimes this will come on very quickly, and you feel like you can't make it in time, and you'll actually lose urine or leak urine before you're able to make it to the bathroom. Other things that can go along with urge incontinence include needing to frequently urinate. So the average person urinates 6 to 8 times per day. That's what's considered healthy for your bladder. But in urge incontinence, you might find you're going upward of 10, 15 times a day and frequently at night. Urge incontinence is often associated with overactive bladder. So that is that frequency where you're going to the bathroom all the time. But not everyone with overactive bladder will actually have leakage. So sometimes people can have overactive bladder where they feel the urgency, but they are actually making it to the bathroom in time. So when you get urge incontinence, that's when you're not making it to the bathroom in time. And this can be very distressing. Obviously, if you every time you hear running water, you have a strong urge to urinate and you can't hold it, that can be very disruptive to your life. Same goes for if you're just trying to get inside your house and you just can't make it in time. Oftentimes, women will find themselves wearing panty liners or incontinence pads throughout the day to manage the urinary symptoms, and it can be very frustrating and not to mention expensive to deal with urge incontinence. Urge incontinence happens whenever the bladder muscle contracts very strongly and the pelvic floor and the muscles around your urethra where the urine exits can't hold back that urine. Typically, for bladder control, your bladder relaxes and fills, and your pelvic floor and the muscles around your urethra or the tube where the urine exits from the bladder are contracted and keep you holding that pee in while your bladder fills up. And then when it's time for you to go to the bathroom, your bladder contracts, your pelvic floor, your muscles around your urethra relax, and then the urine is able to exit. So in urge incontinence, the bladder is contracting very hard when it's not necessarily supposed to, and then that pelvic floor and the muscles that support the urethra are not able to overcome that contraction of the bladder. And so that's whenever you run into the leakage. Urge incontinence sometimes worsens with age. It can also be found in people that have neurological disorders like Parkinson's disease or spinal cord injury, and sometimes the cause cannot be determined. It is important to work with your physician because they have a lot of different diagnostic tests, so they are able to determine if there is a cause to your urge incontinence. They can use a camera to look inside your bladder. They can do some various testing to see how well you empty your bladder, and this can all be helpful in getting you a proper diagnosis and knowing how to manage those symptoms. There's also medications that can be used to treat overactive bladder, and your physician can be someone that works with you in order to help manage that urge incontinence or that leakage when you get the sudden strong urge. If you are seeking PT treatment for urge incontinence, the first thing we will do is get a good history about your typical habits throughout the day. So we'll talk about how many times you urinate throughout the day, what kinds of foods you're eating, what you're drinking, if you're waking up at night to urinate, and just get a better picture about your activity level, if you get any exercise, and also what if you have any triggers that cause you to leak. Once we take that detailed history and really get a good picture about, your daily habits, we'll also talk about what's considered normal for the bladder. So the 6 to 8 times per day urinating. We can also give recommendations about potential bladder irritants. So things like caffeine, chocolate, cigarettes, sodas, artificial sweeteners, anything that is going to irritate that bladder lining can lead to more contractions or spasms of the bladder that can further lead to leakage. So we'll also give you something called a voiding log or a bladder diary, and this is where you can write down and get a really good picture about how many times you are peeing throughout the day. You may think you're only going, 6 times throughout the day, and you really could be going 15, or vice versa. You may think you're going quite a bit, but you really are able to hold it about 2 hours or so. So that just gives you a more accurate picture. So after you have completed your voiding log, we can also work on some different behavioral modifications to help you retrain your bladder. So this would be seeing if you can stretch it a little longer and almost put yourself on a schedule to where you can help space out those times that you're going to the bathroom. Obviously, this is going to be difficult if you get that sudden strong urge, so we will also work on some different strategies to suppress that urge a little bit. So strengthening the pelvic floor, doing some exercises to help strengthen all those muscles and give you more support, because when the pelvic floor is stronger, it can overcome some of those bladder spasms. And actually, contracting the pelvic floor helps send signals to your bladder to relax and fill. Since they kind of work opposite of each other, it can be helpful to learn how to do some pelvic floor contractions when you do get that urge to go to the bathroom, to help deaden that urge a little bit. There's also some different treatments that we can do in the clinic. So one would be called biofeedback. If you're having difficulty finding your muscles, we can use a machine that puts little electrodes or stickers on your perineum area, or just around that vaginal opening, to where we can actually see the contractions of your pelvic floor. So it reads surface signals and gives us kind of a reading of how much you're able to move those muscles. We can also use something called neuromuscular electrical stimulation, and that basically just sends electrical signals into your pelvic floor muscles, and to kind of calm that bladder and strengthen the pelvic floor. Urge incontinence is very common and can be treated. Sometimes even just taking a good look at what you're eating and drinking, also trying to time your peeing, putting yourself on a schedule, and learning how to suppress that urge can all be very helpful in managing urge incontinence. I have had patients who have come in wearing Depends, several, 3 or 4 Depends throughout the day, or wearing heavy, thick pads, 3 to 4 a day, and they're able to feel safe in just a panty liner, or sometimes nothing at all, whenever they're walking around their house and even when they're out and about. So you want to make sure that you take control of your bladder and you don't let your bladder control you. So there are definitely treatments for that. If you are dealing with urge incontinence or that leakage with sudden urge to urinate, I suggest that you reach out to a pelvic floor physical therapist who can evaluate you and teach you some techniques and help you learn how to suppress that urge and treat your urge incontinence. And if you have any questions at all, please feel free to comment on this video, and I can even help you find a pelvic floor therapist in your area. Thanks for watching.